Hello and welcome to the launch of the Africa Reach in the sidelines of the AU Summit in 2023. You will introduce yourself, please, and let us know which organization you come from and, why are you here? What are you benefiting from being in such a launch?
Hello, everyone. My name is Lidigu. I'm a journalist at Nation Media Group, that is the Daily Nation newspaper. I cover health and science, and I have an angling towards HIV. That's what I'm very passionate about, and fixing the healthcare system in Kenya and hopefully in Africa.
Why do you think we need an initiative such as Africa Reach?
Africa Reach is very important because we need someone that pushes us to go to our goal much more faster. And for me, if you hear many of the speakers, everyone is so positive about ending HIV, but we need to do the work. And for example, in Kenya, infections are rising among young children. They're also rising among young girls. So what are we doing? There's a new generation out there that was born at the inception of ARVs. That means that they are now 18 years of age. They are sexually active. In Kenya, for example, the health CS was telling me she's not going to give contraceptives because of her religious beliefs. So these are some of the things that we need to work. For me, I believe we still have much more work to do.
What is your personal or professional commitment to HIV response in your country or across the continent of Africa?
As a journalist, I have the duty of documenting what guys are talking about, what they're feeling. I visit remote places, low-income household settings, where marginalized communities are, and try to highlight those voices because people are suffering out there. And sometimes when decisions are being made, they're being made in posh hotels, where these people who are in these posh hotels, they never get to go down there and see what is happening. But we as journalists traverse all these places. So which is why I think I've been given this chance to also bring their voices to the table and their insights. Thank you.
And what do you think is missing in the HIV response, or what do you think can be done for that initiative to be accelerated?
Number one, we have adults who are not listening to young people. We have adults who believe parenting is about telling children or telling teenagers go left, go right. They don't listen. They can hear them, but they don't listen. So we have a lot of things to do in terms of civic education, because sorting out HIV is a whole package. We have to do things wholesomely. You can't say you are sorting out ARVs so you'll deal with the issue, because there are other factors that precipitate infections, social economic factors. For example, I've met young girls in Kibera slums in Kenya who tell me that they are going to sell their bodies so that they can afford a meal. These are some of the issues that we need to talk about. We have some of them who are dealing with parents who are too stigmatized because they're also dealing with HIV, that they cannot now help their children. How do we address this? We also have children who are raising children, underage pregnancies, of children now who have no idea even what HIV is about, because there's a little girl who told me she found out she was positive at class 6. When the science teacher mentioned, then it hit her, maybe this is why I'm taking this kind of medication. So parents still have not come to terms with how to break down the news to their children for them to be able to make their minds up and know what the kind of situation they're dealing with. So I think we really have a lot of work to do, but we are cut out for it. And I think the progress will be more rapid.
And in closing, what is your call to action? Talk to African leaders right now. What is it that you can say?
African leaders, make contraceptives accessible. Don't use your religious upbringing, your morality, your positional, personal feelings into this. People are suffering out there. People are dying. If we were so morally upright, we would not be having things like corruption. So please make contraceptives available and let young women have a voice on what to do also with their bodies. Thank you.
Thank you so much. We appreciate it. Thank you.